We have roll call, Mary.
Pat Rooney.
Here.
Sam Scarmato.
Here.
Al Christensen.
Here.
Marcia Cox.
Here.
Carrie Thompson.
Here. Can we please stand for the Pledge of Allegiance? In a moment of silence. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
A moment of silence. We were until we start talking.
Thank you.
Can't say it. I wish we could.
Okay. So are there any calls on public forums?
I haven't been given any.
Okay. And do we need to approve minutes?
Do you want to do that before or after? You can do that before.
Oh, we can do that after Tyler. Okay, so up first we are going to hear a presentation from Tyler Technologies. Mr. Murray, do you want to give any background here on what Tyler is doing for the district?
I can, thank you. Madam Chairwoman, members of the trustee board, we have Kim Ballantyne on the phone with us, and I believe she has some of her associates with her as well. You'll recall a couple of months ago, we've been in the procurement process, or in the process of looking for a new software system for the district, a financial software system. Recently, the governing board of the district approved going with Tyler Technologies and Vision Software, Infinite Vision Software. Part of their response to our request of going to another software system, they have an application which deals directly with our benefits enrollment. So you'll recall last meeting or meeting before that, Hodges Mace, they were here to present. Now Infinite Visions are on the line via this WebEx to give us a demonstration as to their application for benefits enrollment. So I figured it would probably be wise for us to listen to what they have to present, since they are also tied in with our financial system, to make sure that perhaps what they're offering will allow for a more of a smoother transition. I don't know, Hodges Mace may very well be able to have smooth transitions between Infinite Visions and their software system as they presented before. So I figured we'd give Infinite Visions a chance to demonstrate their system for you this afternoon.
Is this one part that's not purchased currently? Is this an add-on, or
It is an
is this
add-on.
part of what you have already?
It is an add-on, however, it was part of the original quote that we received with the board approved. So this has already been included in the actual software, this transition, software adoption and licensure, this part of it. So this was already factored into the dollar amount that the governing board approved.
Okay.
Kim, go ahead and hopefully we have this new system here that's available, or at least it's now up and running. So we tested it earlier, so everyone in the room should be able to ask questions from where they are without having to shout, and hopefully we can hear them quite well on their end. So Kim, go ahead and take over from here.
Okay, thanks, Michael. Hello, everybody. We just wanted to get a chance to cover an area within what we had put together for you guys specific to benefits enrollment. So in the overview today, what we're going to cover is the view of online benefits enrollment as an employee. So if I'm going in for open enrollment or a life change event or a new hire, We'd also like to show you some of the management of that component as somebody in the HR benefits or payroll area, how you can use the system to track what's going on, see progress, handle notifications. And then the third area that we're going to go into, Infinite Visions being an enterprise resource planning, meaning that it's one database and all areas or departments of Lake Havasu have access to the same information. We're also going to be showing you that when an employee goes through benefits enrollment, that information is then available for payroll without having to rekey anything, and it's also available as you guys process any reporting to providers or any federal or state reporting that might require that information. So those were kind of the three areas that we wanted to cover. Can you guys hear me okay with the audio?
Yes.
Okay, great. So what I'm going to do is let Jamie, one of our solutions consultants here, we're both on the line, go through those three areas. And you guys feel free to ask questions. Michael has offered to just kind of let us know if we've got a question in there and let us know, and we'll be happy to answer it. And if it's something that we need to get back with you on, we can follow up as well. Okay?
Great.
Okay.
Okay, I've shared my screen with you all. Can you see that?
Yes.
You guys kind of see the Tyler
Okay.
Technologies logo there?
Yes.
Yes.
Okay.
Okay, great. Well, I'm going to get started in, like Kim said, just kind of walking you through the process for going through benefits enrollment. So the benefits enrollment piece is integrated in with the employee self-service web portal. And this is the web portal your employees will already be used to going to. As employees of the district, they'll be logging into this portal to access their paycheck stubs and to go through their self-service, changing their direct deposit, changing tax form addresses, things like that. So they won't have to have another login or credentials. They'll just be able to log into the regular employee website they're used to using. And we'll have this benefits area of screens here for them to actually access their benefits. When it's time for benefits enrollment, they'll go to the benefits enrollment piece, and this is an example I'm going to walk you through of what a benefits enrollment process could be as an employee. So I'm logged in as an employee right now. But this is a highly customizable process. So these are just example screens. Your process will be built with you, and it will be very specific to your needs. So whichever benefits you need to have over here on the left, whichever different benefits you need to have your employees go through, you can customize welcome screens like this. There'll be some other places as we go through this. I'll point out where the customization options are. This is going to be very tailored to what your employees would need to see for your district. This is a wizard process, so as an employee, I'm basically just, kind of filling out each screen and hitting the next button, and it's going to automatically walk me through the process. The first thing I'm going to need to do here is choose, why am I going through enrollment? And we have obviously three options why someone would need to go through benefits enrollment, and these are locked down. So right now, the employee I'm logged in under, it's open enrollment time. So I can't select that I want to have a life event or that I'm a new hire. You're going to have control over who accesses this system for enrollment and when they can do so. If I do have a life event or if I'm a new hire, you can open it up to me during those times as well. You may have a screen in here in this process verifying the employee address. You can change the employee address on the web portal. Any of these changes goes directly into their employee maintenance their employee maintenance area in Infinite Visions. And since Infinite Visions is going to be your system of record for HR and payroll, then it makes it a lot easier. You don't have to push and pull data from any other systems. Any changes that an employee makes while they're going through benefits enrollment is going to go ahead and update their HR and payroll information without having for you guys to take any more steps. Emergency contacts can also be a part of this process if you wish. I can review my current contacts. I can add a new contact if I need to. Next up is dependent information. So you'll see I already have some dependent information filled out here. If you have this employee is a previous employee, they already have dependents loaded into the system. Maybe they've gone through enrollment before. They don't have to re-enter everything every year. We already need to store this information for all of your federal and state reporting, so that information is already going to be in here. I only have to verify whether or not they are still in fact dependents, or I can add any dependents that may be new. Beneficiary information is also included as part of this process, so I can change my beneficiaries, add new ones as I go through, or just verify the ones that are already in here. We also have that, if I go up here to the main menu, we actually have this separated out as a separate screen so that employees can also go in and change their beneficiaries anytime during the year if you want to allow them to do so, because it doesn't have to be, typically it doesn't have to be around just your open enrollment period. So if it's, after this period and I want to change a beneficiary, I can always do that in the web portal as well. The next screen is our first benefit election screen. And this is an example of what it might look like for a medical insurance enrollment process. At the top, we'll have some instructions, and as I said, you guys get to customize these. So, whatever instructions you want to include, you can. If you want to add additional text or change how it looks, make things bold for additional emphasis, you guys can do all of that. What a lot of people will do is link a document up here. If maybe you have like a plan explanation, benefits booklet that you want to go ahead and link to this page, you can do that, and the employees can access those and download them so that you don't have to additionally provide them with paperwork. Next, we're going to elect what benefit I'm electing here, and all of your options are going to be shown in this area here. Now, these are going to be determined based on the settings that you already put into Vision. So you'll set certain types of employees up with certain coverage options. So I'm logged in right now as a principal. These are going to be my coverage options. If you're an administrator or a teacher, you might have different plan options. So it's going to be based on what type of employee you are. That's going to determine what type of benefits you see available here to elect. We are also going to use that employee and position information that we're already going to have in Infinite Visions because we have to pay these people. So Infinite Visions is your payroll system. You're going to be paying. We know we have to know these employees' work calendars, how many pay periods they get paid over, what their salaries are. So in order, so that data is already stored in Infinite Vision. So what we do is we take that payroll data that we're already using, and we use that to calculate what the per pay period cost and the employer contribution would be for this employee. So it takes into account how many pay periods I'm being paid across and automatically calculates what my per pay period cost would be for all of my different options here. So another benefit to having this integrated with your ERP system is you don't have to do those calculations or add that additional information into a system. We already have all that data, just as, because we need to normally pay these employees. One of the other things built into this process is going to be error checking. So if I try to pick a plan that doesn't, maybe I try to pick a plan that doesn't allow a spouse dependent. If I hit next here, it's going to let me know that I didn't select the appropriate dependent types for the plan that I had selected up here. So it makes sure that I am making the appropriate elections. What it'll also do is if you look over here on the left, you can see on step 9, we've got a high HSA enrollment piece. Well, it's only going to allow me to go there if I choose one of these high deductible plans. If I don't choose a high deductible plan, then it's going to skip right over that HSA screen and just move me to the next step. So it's looking, as I go through this, it's looking at what I elect, and it's determining, you know, what are my further steps in this process? What do I need to fill out? You can have pop-ups like this where just make sure that they read any additional information that's on the screen, any instructions or you know, warnings or anything else that you just want to make sure that they read, and then you can have to hit OK in order to go to the next screen. And the rest of the process is going to be just very similar. So you go through all the rest of your insurances. If you have vision and dental, HSAs or FSAs, life insurances, this, like I said earlier, is going to be tailored to your benefits. So there'll be as many steps as you need for an employee to go through all of their benefit elections. One other thing I think I forgot to mention is as I go through this, if I don't want to make any changes, it's just going to have defaulted what I have selected for the prior year. So I don't have to go through and elect everything from scratch. If I had selected a medical plan for last year and I don't want to change that election, I'm just going through and hitting next through these screens and verifying everything. I don't have to start over. Once I get to the end of the process, there will be a statement. You can see that in step 19 over here. There's going to be a statement that I can download as a PDF and print or email if I need to. If you want, maybe somebody wants to, you know, elect their benefits and then save the PDF to discuss with a spouse or family member before they actually go ahead and submit everything. They'll get a statement that they can save. And if they're ready, they can go ahead and submit these. Whenever they're ready, they can go ahead and submit this. Now, I can come back to this. So if I get to step 8 where I am right now and I need to stop and come back, I can just simply log out of my portal and come back, and whenever I do, it's going to remember that I am at step 8, and it's going to start me back off here so that I can finish the process. I can also access that enrollment detail statement anytime I need to as well. So even if it's after open enrollment, I've already made my elections and it's been submitted, I can go back and get that enrollment statement anytime. One other thing I wanted to point out to you while we are on the Employee Self-Service web portal is Infinite Visions also is going to be able to generate all of your required state and federal tax, state and federal reporting, and that does include your, obviously, W-2s, but also your 1095. So just as a regular function of Infinite Visions, kind of outside of benefits enrollment, we're able to generate the 1095 forms in our system. So if you generate those in Infinite Visions, then you can then publish them to the web portal, and the employees can get those electronically from their web portal. They can download it as a PDF, just like I've done here. Okay, before I move on to the next piece, are there any questions about the online enrollment process?
Are there any reminders during open enrollment for, like, you know, you have 10 days left, 5 days left, that kind of a thing, where people don't miss out if they're not watching the reminders?
Sure. Absolutely. So if you go back to the home screen, there's one option. The first option is an announcement. So you can post announcements on your employee self-service portal to remind people about the enrollment period, so that when they first log in on their homepage or really anywhere throughout the portal, they can have an announcement reminding them about the process. There is also, and that actually is a great segue into the next section, which I wanted to go over, the management side. When you are managing who hasn't completed their enrollment process, you're going to have a screen here where you can view who has completed, who has started, and who hasn't started. From here, you can choose certain employees to send reminders out to. So what I can do is is I can say, well, I want to see everyone who has an open enrollment. So everyone who has started, but who hasn't actually completed their process. And then I can go up to actions here and I can email these employees. And when I email them, I can customize what I want in that email. So if I want to send them a 5-day notice, a 5-day reminder, if I want to send them a reminder, hey, you started, but we see you haven't finished yet, you can do that, and you can customize those as you need to.
And you can do that the same for qualifying events and new hires, I'm assuming?
Absolutely. This screen where you get to manage the enrollment, it will, it's the same screen you're going to use no matter what the situation is for why the employee is going through enrollment. You actually have a little filter, a little column over here that says the enrollment type. So you'll have in here, if you do need to filter down or separate the employees by whether it's just open enrollment time or whether they're a new hire or a life event, you can do that as well.
And so for the current employees that are part of the district and have insurance, is there's going to be a time when that information is going to populate into this system through like a CSV file or something, or how's that going to be done?
So depending on your implementation, we would be converting over certain information, and then we would typically time benefits enrollment for your first open enrollment. So we kind of have a couple things when you're brand new. We would be importing some information and setting it up, and then timing it for your open enrollment. Your new hires and your life change events may come up if that makes sense. So there'll be a little bit of a timing of this for your first time coming on board.
Right, but as far as, so, and I'll ask this question maybe to Mr. Murray, or you can answer. So my understanding is we're going to use this for HR and payroll, yes?
Correct.
And so when will that go live for HR and payroll?
July 1st.
Okay, so, and then the open enrollment will be in May for medical. So that will all be populated into this system before May, or, I mean, that would be the goal, obviously. Okay. And then what about paperwork for dependents and things? How do you verify, is that a, manual entry or proof, has to be submitted to the business department here or HR to prove a dependent is eligible?
Right. Well, part of Infinite Visions, and I think that's where Jamie was going here, part of Infinite Visions lets you guys decide also the different forms that you guys may require for certain things so that you can do this paperless. So you can have them scan in and attach forms to route to HR or payroll. You may make them required, and then you can put some workflow around that. So you may have a dependent, a lot of times with a life change event, there's certain documentation that you might need. So we would work with you guys to understand what are those forms that we would want to automate as well so that the employee could submit those from the portal.
So let me make sure I understand, on the forms, whether they're dependent forms or whatever, are you saying that you have like a fillable form that can be scanned back and it'll populate the fields, or that once the district receives that form, it'll have to be manually entered?
That's a great question. So on the different form types, some of the forms like direct deposit and things like that, they're going to be laid out so that those changes do come over automatically. There's also some form types that will create like a fillable PDF. They may not be something that you're storing necessarily in a field within the system, but I need to capture the form, or I need to capture the actual image of something that you're submitting to me. So we do have some options on how we set that up. So here's an example that Jamie is showing where I had a request where I'm filling in certain information that the district would want to capture, and you guys can decide whether or not you also would require supporting documentation.
Okay.
In this example, once I fill out this form, as an employee, it can go through a workflow process, and then the end result is that the form itself gets saved as a PDF in my employee documents, which is stored inside of Infinite Vision. So this is an example of an overtime request, but this is a common use for these types of forms or for things like dependent verification. So you can make the process paperless. They can just submit the form in the web portal and then scan any supporting documentation and attach it to this form.
Okay.
Any other questions? Okay, so I'm just going to move
Hold
on to the next section.
We have one question.
And I kind of gave you a...
We have
Oh,
one
I'm
more
sorry.
question, sorry.
She showed a sample of the annual ACA reporting form. Is that something that's going to be, I noticed that it was blank on the example. I was wanting to make sure that that's going to be automatically populated, those check boxes, and the information for the ACA is going to automatically drop in, or do we have to do some manual entries on it? The January,
So,
February, March.
This,
Did you hear the question?
yes, so in Infinite Visions, we generate this 1095 form that you're looking at here, so this is the 1095C. This information is generated and filled out by the system. So this isn't like a fillable PDF that somebody had to manually go in and put and type everything in. There are some settings you'll have to assign the employees to the appropriate coverage groups in the system, but the system actually generates this form. And I don't have anything in the covered individual section because in my example, the district isn't self-insured. But if you are, then it would also in Part 3 show the names of the dependents which were captured during open enrollment.
Okay. Thank you.
Kim, does it have a process for managing voluntary term life with amounts in excess of the guaranteed issue and pending those?
So back on the open enrollment area, when we configure that, you're going to actually tell us what your policies are with respect to district supplied insurance. You're going to tell us if it's voluntary life. You're going to tell us how we calculate or set that up so that we display it. So those are options when we configure that for you. The only time that you may have a situation, let's say that you have a AFLAC option, right, where somebody may be selecting something and the provider of that insurance needs to do some separate calculations that are done maybe based on a medical clearance or something like that, right? There's other variables that may need to happen to verify that insurability. Then we can actually set that up in a kind of pending state. And when we get that value can be entered in and you can go ahead and process that deduction.
So for example, what I'm trying to get to, so say they've got a $100,000 guaranteed issue and somebody applies for $150,000, is there a process where it would go into a queue for HR so they could withhold up to the 100 and then pen the additional 50 until they get approval from the carrier?
And like the 50 might be dependent on approval or something like that?
Yeah, exactly.
Yeah, so when we configure those screens, the team that works with you on that sets those controls up. So they may say, here's where you select the 100,000. Here's how you make the selection or the request for the 50,000. The 100,000 is automatic and is going to come in. The 50,000 might be pending on the approval. But yeah, we put those in and we put the error checking in around it, right? So if someone tried to key, 150 in where they could only put the 100, we also try to put those parameters in there so that it's stopping the user, right, from a usability standpoint, they're not able to make an incorrect selection.
Okay. And then does it have any kind of a mechanism for managing dual spouse where you got two employees who are both employed by the district and one, say one is carried as a spouse but still gets the employee benefits for like life insurance? Is that a way of managing that?
Yeah, you know, and I can provide you guys with a little, so that does come up a lot with districts here, at any district in states, but certainly districts within Arizona. So I can check in with the team on how they handle the dual spouse component, but yes, that does come up for selection options that we've had to handle that.
Okay, thank you.
You guys good? If do you have any other questions? We can maybe go. Is it okay to hit to that next section?
Yes.
Okay, thanks.
Okay, so I already gave you guys a little information about this screen, but this is basically where you're going to be able to manage your enrollment. So if I can log in and see who has completed enrollment, who is in the process, and who hasn't started. I can use the filter and sort tools that we've got in all of our grids to filter by employees, by enrollment type, by insurance, actual insurance grouping, and I can export this to Excel if I need to, do any reporting on any of these. I can also, like I said earlier, email these employees. So all the management of the enrollment process for your benefits team is going to be able to happen in this screen. And once you have reviewed, so if you can review the employees that have completed their enrollment, once you review those, you're going up here and you're going to actions and posts. And what this posting is going to do for you is it is going to go ahead and basically say, well, first of all, you reviewed and you approved their enrollment, but it's also going to create or edit any necessary deductions in your HR and payroll system. So by posting their elections here, it means that your deductions and benefits for HR and payroll are going to be basically prepped and ready to pay. We link all of the elections for the benefits process to an actual deduction in our system. So if I go into, if I just go into our regular HR payroll menu, and I can see my employee deductions and benefits screen, this is going to be the screen where we just manage actually paying or withholding these deductions and benefits for an employee through normal payroll. So the elections are linked to these deductions in Infinite Visions. So by posting, it just automatically looks at this employee's record, and for example, with the health insurance, it either changes the election. So this employee's already selected the Insurance 125 plan employee plus children line, so it might change the election to a different line or to a different plan. Or if they didn't have this, it would create this record that you're looking at, and this is what we use to actually pay or deduct this amount and pay in turn paying the vendor during your regular payroll processing. So this is a record that you, regardless of having benefits enrollment, your payroll team is going to be using this screen and managing it just to manage your own payroll process. And through the benefits enrollment, it means that these will automatically be updated. So you won't need to go in and manually create these records or edit these records or anything. It's going to automatically come through based on what the employee elected. And then the last piece I want to point out for you is the generation of the 834 file to your vendors. So we are going to set up in Infinite Visions, we're going to set up each of your carriers and their requirements around their electronic 834 file. If they accept an electronic file, then we're going to set those criteria up in the system, and then whenever you need to provide your carriers with insurance with the updated information about who the employees who elected benefits, maybe you need maybe you send them a monthly file, maybe anytime you have changes, whatever your process is, that carrier, you can just come in here and select the carrier. From this drop-down menu, you can choose which employees you'd like to include in a file. That can be by employee type or by actual, maybe it's just one specific employee, or maybe a date range, so changes for a specific date range. And you're basically creating the file to then turn around and upload to the carrier. So once I select my criteria, this is going to generate a file in the appropriate format that this carrier requires, with the appropriate naming convention. You can see down here that for this example with Assurance, this was the kind of file name that they require, so the system has automated that file name creation. It's an Excel file. In some other, carriers, it might be a text file or a .dat file or something. It's going to automatically, prep that to save, and all you have to do is hit OK. It generates that file, and then you can turn around and upload it to your insurers. So you don't have to have a paper file to submit to them. You can just turn around and, generate this file for electronic upload.
Is there a maximum number of vendors?
No.
Okay.
The other thing that is part of the benefits enrollment service that was included with the other modules, and it's unique to benefits enrollment. Our team works with you every year to tailor any annual changes. So it's very common that you guys might be adding a new provider, making a change with a provider, starting out with a provider that you haven't worked with before. So we get together with that team and we work on the configuration changes for the experience that the employee is going through, and then we also work with any changes that may be required from your communications to your providers, and that's included in your ongoing support.
And I notice you have a file, a TPA benefits interface. Is that considered an 834 file, or is that separate?
Over on the left, kind of on that menu tree, the TPA benefits interface, right. So if you didn't go with the benefits enrollment module and you went with something like the vendor that you guys were looking at, we have a way that they could import information. They do have to meet a particular file format, and so we have an interface option. Some providers are able to meet that file format, so that is definitely something that you would want to verify, with the vendor ahead of time. I would say most of them are used to working with payroll systems, but we have had some that aren't able to produce a file. So sometimes what happens is they give you paper enrollment information, and then those have to be re-entered into the system.
Right. But so Aaron, on Gilsbar, then that wouldn't necessarily need to interface with this, or it would?
It probably would. I don't think any of this would have.
I think they would.
Put all directly.
That's what I'm thinking. Okay. All right. Cool.
Yeah, there's usually two things that you probably want to check. Can they provide the enrollment information to you, and what can they accept from you electronically? Because you'll need to communicate the pay information, the frequency, and the type of pays so that you get the right amount coming back. Some providers only transmit the elections, and then you may still be required to calculate the annual amount. So those are some good questions to verify with them. .
And during that open enrollment period for, like if the employee or if anybody has a question on filling out forms or whatever, do you have like a live help chat or something like that available, or any kind of little tutorials or webinars or anything?
Yeah, the application actually does have the ability to do chat within it, and you bring up a good point. It's kind of designed for light chat. Sometimes we have the employees may call in because the questions they have might be around coverage or district policy, not necessarily just the software, so there may be some things that we post right onto that portal around frequently asked questions or things specific to Lake Havasu. So there may be some questions that the district might still need to handle because they may be policy specific as opposed to how do I navigate the application, if that makes sense.
Okay, sure.
Did we miss anything that you were wanting to get a feel for? We were trying to hit from employee experience, from the benefits management of the process, and then also show the tie-in component with the HR and payroll.
I think that's it. Any further questions for Tyler? I think that's all.
Okay, thank you for the opportunity, and if you guys do find some others that come up, we'd be happy to answer them.
All right, thank you.
Thank you, Kim.
Okay, thanks a lot. Bye-bye.
So the one thing that I just wanted to verify with you, Mr. Murray, this has been purchased by the school board already?
It's been approved, correct.
It's been approved
Yes.
for purchase. Is there, is this a one-time cost, an annual cost? How will that work?
Well, the whole system in and of itself is, there's a one-time when you purchase all of the licensing for it, and then there is a renewal cost and an annual cost thereafter. So there will be an ongoing cost for this application.
Okay.
But as a total package, it's definitely a lot cheaper than what we currently have,
Yeah.
even factoring this in.
And seems to be able to communicate with our vendors,
Yes.
so it should eliminate some of those issues.
And I know the question came up last meeting about should the EBT pay for a system such as this, or should that be on the district? Again, this was factored into the district price already. And in my opinion, with this type of a system, or this application where it ties in so well with HR and payroll, that I believe that, I don't have a problem with, for now at least, having the discussion where we've already adopted it for this upcoming year, that we would go ahead and pay for it, but then maybe in the future leaving that up for discussion as to who would pay for that application. But I think for now, it ties in so seamlessly with all parts of the business office, it makes sense for us to just move forward with it, pending your approval recommendation.
Okay, thank you.
And doesn't, I guess I'll just confirm that the price of it goes down, so I know that there's an initial upfront cost, but if I remember right, the cost per year seems to become lower and lower.
Correct. And the reason why the upfront costs are so heavy is because there's so much professional development and training and crossover involved the first year. But after that, all we're paying for is just the renewal. And it's by year 2 and 3, we'll probably save almost 75%, 60 to 75%.
And that's including with this built into that fee?
Application.
Okay.
Any other comments or questions for?
Do you know what the significant differences are between this and the Hodges Mason? I mean, I know there's more bells and whistles and things on the Hodges plan, and we're pretty.
The interface, there's definitely
obviously
night and day difference there, but I don't know. I think they both are pretty comparable from what I've seen. I know that there's a district in the state that is currently with Hodges Mace who had visions before and went to Hodges Mace, but from what I've heard just recently that they're actually moving back to visions because there were some issues with the way the two systems were communicating.
Seems
So
to
that
me
was-
be simpler to have one system.
Yeah, I guess the only question I didn't ask, and maybe we could follow up, but it probably isn't a big deal, is what happens if we decide we want to separate ways? I mean, obviously, you can do that if someone else was on.
Yeah, like I said, there's a pretty good sized district down in the Phoenix area that had visions this system at first. Then, like I said, they transitioned over to Hodges Mace, and now they're moving back towards Infinite Vision. For the I have not yet communicated with that district, and that is part of my plan for this week after hearing that earlier on by Ms. Valentine. And I see if I can get some more information as to what their major concerns were as to why they're moving back.
I mean, obviously, it makes sense if it's already, been approved and it's part of the cost.
Yeah.
And the interface is going to be similar, and we're looking at another $50,000 if we
Yeah.
don't, so.
That was a high cost.
I do want to say that I think Hodges Mace, when they came here, I think it's very clear that they offer a very well-developed product.
Oh,
It's
yeah.
Very, very nice and very well put together. But I think from what I've heard with speaking to Ms. Valentine, a lot of times it's pretty difficult with the way school districts function and the many different payroll assignments that they have, with some people getting paid 26 weeks and 24, and some working 261 days and others that are working 180. There's just so many different pay structures, payroll assignments that, in the corporate world, it may not get as complex as that. So perhaps that's one of the reasons why that other school district is transitioning back.
And this is Vision's bailiwick, doing all school
That's right.
districts and whatnot.
Madam Chairman,
Yeah.
as I indicated when we were outside, I have another board meeting I have to go to. They don't tend to be very long, so I'm just going to leave my stuff here. And I'm acting chairman today, so I have to be at that one. I'll be back before there's any, do we have any appeals today? To vote on today? No. Okay, I'll be back shortly.
All right. We can go ahead and move to ratification of our minutes. So these were all sent out electronically for review, and I think we've made adjustments and edits to those. So if we could go one by one, vote to approve those, then I can get those signed for Mary.
Do we have to vote on this first, or?
This was just up
the
for
Tyler?
discussion today. There's no vote on
Okay.
that, and there's no vote because we're not purchasing anything either.
Okay, so we're doing the vote on ratification of minutes.
Yes, September 28, 2017.
Okay, Sam Scarmato, Hal Christensen,
Yes.
Marcia Cox.
Yes.
Carrie Thompson.
Yes.
How
Approval.
about me?
How about Pat Rooney?
No,
There's no.
No longer a
Oh.
voting.
Oh,
Oh, I don't vote.
oh, that's
Gee,
right.
how disappointed am I?
But you still have to show up.
I'm real disappointed now.
October 2nd.
Okay. Sam Scarmato, Hal Christensen,
Yes.
Marcia Cox.
Yes.
Carrie Thompson.
Yes. October 16th.
Sam Scarmato, Hal Christensen,
Yes.
Marcia Cox.
Yes.
Carrie Thompson.
Yes. October 30th.
Sam Scarmato, Hal Christensen,
Yes.
Marcia Cox,
Yes.
Carrie Thompson.
Yes. All right, I'm going to go to the medical reports. I had asked Dave and some of our vendors to do like a recap and a quick presentation of where our numbers are and where we're moving in as we kind of transitioned to ECA, and as we had a new sitting member, who's no longer here. But we will have some, there are some questions and some things that have come up with those that hopefully that we can discuss briefly during the meeting. So I will start with the medical claims report. Gills Bar.
Okay. Hi, everybody. Thanks for having us here today. We handed out, or we sent over the health plan analysis. Does everybody have a copy of that?
Yes.
Yes. Okay. So we'll go ahead and jump to page 1 of the health plan analysis. This is the claims by major diagnostic category. And here we have 20 listed major diagnostic categories, and we typically go through the first 10 to identify who in those categories has the highest cost within those categories, and kind of identify what those illnesses are within each one of those categories. So I'll start with the very first one, which is neoplasms, which is your cancer category. Total issues so far, and this is claims reporting from July 1 until October 31st. So just from the beginning of the plan year until October 31st. So number 1 is neoplasms. Total issues so far is $114,785. We have 3 employees within this category. One of them has the highest cost at about $36,000, and they were just recently diagnosed with a lung cancer. So that one is going to most likely be an ongoing condition for that member. So far, this far into the plan, is $36,000 spent on just that diagnosis. We have a spouse with $34,000 and spend, and this one was for uterine fibroids. I don't have the further diagnosis to see if that's cancerous or not, but it does fall into that category. We have an employee that is ongoing treatment for breast cancer, and she is at $18,000 so far. So 3 members are making up the bulk of that cost of $114,000 under the neoplasm category. Number 2, under infectious diseases, we have so far $81,803 in total spend. We have 2 members in this category. One of them is actually a spouse and an employee, both of them with the same diagnosis of septicemia. And if you remember, these 2 members were ongoing last plan year as well, so they're continuing with their care into this plan year. The very first one is at $41,000 in spend, and the second one is at $38,000. So 2 members making up the bulk of that cost. Number 3, factors influencing health. We have $73,000 in spend, and this one is a combination of a lot of major diagnostic category. It could be anywhere from vaccinations, it could be your preventive care visits, pap smears, mammograms, prostates, pregnancy, contraceptives, kind of everything that falls into that category. I didn't see anything alarming in that category, so that one is not bad. Number 4 is your genitourinary system at $67,000 so far. We have 2 members in this category. Both of them are employees. One of them is being treated for kidney stones. That one appeared to be a one and done situation there at $44,000 spend. The other one was endometriosis of ovary, and that was $18,000 to spend. So both of those do not seem like they're going to be ongoing, but again, I don't have the clinical records or the case management, so I'm not really certain about that one. Number 5 is going to be your digestive system with about $58,360 total issued. We have 2 members in this category. Both of them are spouses. First one is being treated for diverticulitis at $29,000 spend. Second member is a spouse, and she is having complications of artificial opening of stomach. It's like a nutritional support, I can't pronounce this, I'm sorry, gastrostomy. So complications from that, and it's about $11,000, and that's in the digestive system category.
If you want to kind of just like touch on the major things, or if you see there's concerns in there. 'Cause
Okay.
we did get to review it prior
Okay.
to this week.
All right, so the rest of them, I didn't see anything major jumping out as far as like a spec claimant or anything in this category. And it's really so short in the year, so we really didn't identify anything. But the first two were the ones that seemed the highest. So what we'll do now is we'll kind of just move forward and we'll go over to the high cost claimants. So we'll skip a few pages and go to, so yeah, I won't go through the whole entire HPA. Okay, this is going to be page 8. Page 8. And I did run an additional report this morning because I wanted to get the total claims for everybody on the high cost claimants as of today. So I do have quite a few members on this one. One of them is an employee, and she has really high cost in prescriptions, right around $151,000. She's being treated for cystic fibrosis. So again, the bulk of her spend, $151,000, is going to be on prescriptions only. Her medical care, $200 so far. So that's a big one for cystic fibrosis. The second one is going to be your sepsis member, and we went over those on the first major diagnostic one. This member has a total of $102,000 in claims, so she's definitely 50% of the spec deductible. But for the sepsis alone, she's just over $40,000 in that category. Let's see, I have a third member. She is also the sepsis, so we have 2 people in the sepsis category. Overall, for this third person, total claims is $75,000 so far, but for the sepsis diagnosis alone is $38,000. So again, this one is at 50% of that spec deductible. So we'll probably watch those to see how they go throughout the year. Chances are they may become a spec claimant. Let's see, moving down, I have another one with pretty high RX. This one is at almost $53,000 in RX, $57,000 total in all claims. She's being treated for chest pain and diabetes, chronic viral hepatitis. So that hepatitis right there is going to be a big one, and that's going to be on the pharmacy side. We have another member here with about $50,000 of spend, and this one looks like it might be your lung cancer patient. Have not met 50% of the spec deductible, so that's where we are so far. So those are the highest ones that we're seeing right now so far into the plan year until October. Questions?
Nope. I think we're good. It's just, I know it's early into the year, but it's good to see a downswing in total medical paid out, because last year's prior period was almost at $1 million. We're only at $600,000 now.
Right. I think it was 37%
Let's
lower.
hope the trend continues. All right. Can we move to dental? And Rich?
Thank you, Madam Chair, trustees. Appreciate the opportunity to be in front of you all today. I'll start by saying, I was telling Dave and Mike this. I was checking out of my hotel this morning and happened to be staying next to a gentleman. I commented on his boots, and he left me with, "I hope you have a pretty good day." So I hadn't heard that one before. So I'm having a pretty good day, and your overall report looks pretty good. So we'll move into it. On a simplistic, keeping it very, very short, downward trending, 15% year over year, $29,000 savings. So that's always easy. Starting the presentation, usually people stop listening right after that. But overall, very, very good news. Uneventful report. Typically what we're used to seeing, as an example on page 3 for any of you that are following, our hot months, January, June, July, when our staff available to go to the dentist, available to take some time. So our more expensive months. On page 4, something I wanted to note, overall your employee cost share is at roughly 12%. This is actually really, really good by a benchmark standard. Typically, we want to see it 20% or below, so 12%. Your trust, your overall is seeing costs down, your employees are benefiting from it. A lot of this has to do with the network partnership we've grown over the last 7 years, and that 99%, actually 99.8% of all your claims are going through the network. So you are basically an example case for our company. We have 0.2 of a point to work on as far as controlling costs. But again, that's a huge compliment to you all, to your staff, to the employees. Looking at page 5, overall looking at the health of what we're trying to control, your overall dental health, you're getting closer to some of those national benchmarks. Our type 3, our major spend is actually going down. So again, just good positive notes of what we want to see, where our dollars being spent, how are we controlling some of the overall oral health, and what can we improve on. If we look at page 6 briefly, again, almost nothing notable. As you can see, your trends over the last 3 years, year over year, very sustainable. Nothing that jumps out. And I mean, oral surgery, if you want to pick on one, we moved from 2.8% to 6.1%, but we're at a $10,000 spend. If you have something happen in that category, that percentage is going to fluctuate quite a bit. So just based on the overall dollar spend we're spending. Ortho 2.7%, right on the mark. Page 7, again, this is just, if I could frame this and take it to my corporate office at a 99.8% in network, I would. We've used your case actually in some examples in some of our corporate conversations. I wish I could do this in some larger cities. But again, this is a huge compliment and partnership to you all to be able to get this done. You can see, compared to our benchmarks across the state, you are unique. Looking at page 8, what is that network? What do you pay us for? What does this mean to you all? We've shown this in the past. We show it 3 different ways. We show you raw data, and we show you 2 other benchmarks. So 21.8% savings right off the top. Good to see that's maintaining. And then 50%, or excuse me, 22.1% off the 50th percentile and 34% off the 90th. Again, that 90th typically in dental is more of a benchmark of what we call retail. So if you're going to go somewhere to a dentist that's not in the network, the retail charge is what they're going to provide for you. If you want to save money, we encourage people, just like on your medical or any other benefit, how do you go to a contractor or in-network provider? It's good for the trust, good for them, saving money, and continuing to be able to provide the benefits at a low cost or no cost to the employees. On page 9, where exactly are our dollars going? Again, throughout the city, one in Scottsdale, Bullhead, Parker, majority obviously all throughout the city. And those are all folks that we already have relationships with, so that's a good note. Last but not least, on page 10, our involvement, our partnership, is it a win-win? What can we bring back to you as a trust? So overall, for the $16,000 you spent with us this year, we've saved you roughly $148,000 between our claim system savings and the network. Overall, looking over the past 3 years, you've seen roughly a 9-to-1 return.
It's good news. Good day.
It's a pretty good day.
Pretty good day.
Any other questions I can answer on the demo? Okay, thank you again.
All right,
Appreciate it.
thank you. All right. Do we have a representative from United for Vision? Or Dave, can you kind of go through that?
Absolutely. As you can see from the report, basically the premiums for the 4 months in question at $13,962 versus claims of $16,000 leaves us at a loss ratio of 118% loss ratio. Claims count 158. So we're averaging cost per incurred claim of $105.02. So, as I mentioned the last trust meeting, if that trend continues, you can expect United to seek a fairly healthy rate increase to cover their losses and to then project for the future. Any questions?
I had just a couple, because I did contact you last week with the number of vendors, and United did get back to us. We currently have 4 providers, but one of those listed is Nationwide out of JCPenney. I've had a few employees go and they say we're not covered there, so is there a way to verify that or have United call and check in?
Absolutely. Nationwide?
Yes, which is through JCPenney.
You bet.
And then it's interesting that our claims seem to be, or we seem to get good experience, but what I hear back from employees is that it's hard to get in or see providers. So I'm wondering if we're going to see even more utilization as the year goes. I'm not kind of sure how it's going to end up.
I'm not either. I did some research with some other, with our prior organization, and he is in contact with most of the providers up here, and the providers that were in who have left were not happy with United. I always laugh at that because did they know what they were signing up for? So if they knew what they were signing up for, then why complain or why leave? But apparently they have, and he continues obviously to meet with them, and he's more than happy to get another quote back out to us if that's what you wanted to do. I can work with Aaron on that.
Okay, that would be good towards the end of the year if we can review that, kind of keep
I'd
an
be
eye
happy
on.
to do that. He's obviously very excited to maybe potentially get you back as a client, and he still has all of them in his network. And I think he could probably give you a very competitive quote, but I'll work with Aaron on it.
Okay, thank you. Are there questions on vision? All right. Then we have the RX claims report, and I'll refer this back to you, Dave, also.
Okay. I went back to our vendor and asked them to give us information from October of 2011 when we started with them. And so we've got that report, and then you've got the rest of each period, July of 2012 through June of 2013. As you can kind of see, it fluctuates a little bit. The real 12 months, if you looked at the 12 and 13 period, 718,000. Then the next year, in 13-14, we dropped to 635. And then for 14-15, went to $700,000, $396. And then, as we all know, prescription drugs are one of the fastest growing costs to any health plan, averaging somewhere between 10 and 12% a year in increased costs. New drugs are coming out. People demanding drugs from their doctors, and so the next year between 2014 and 2015 we went to 700,396, and then the next year 15-16 895,000, and then the big one is this last year 16-17, as mentioned by Joyce with regard to prescription drugs. We went to $1,084,000, which is a 21% increase in prescription drug use. And I should remind everybody that this is nothing coming out of the center. This is just retail that the employees are purchasing from pharmacies in the area or out of the area.
Maybe I can refer this to Joyce too. Do you think that this year, with some of the cases that I have heard, we've already been tracking some of those high prescription costs, do we think that the 17-18 year is going to surpass the $1 million last year? Or
I mean, there's a couple of sick people that hepatitis C is one of them, but that's only like a 6-month treatment. Could only run like maybe $100,000. And then we have the one, the cystic fibrosis is I think the one I saw.
As I recall,
and then we have
these are totals, but as I remember receiving on one report, there was one individual that hit the trust for $390,000 in prescription drugs.
there used to be, wasn't there a report that we got that broke down the categories? So it had the specialty, the preferred, and the generic?
We can get that as well.
Okay, so maybe that would be something good to track in the next couple of quarters to see if this stays online, because I don't think we can continue with a 20% increase each year with this cost already being over $1 million. This is more than our center and prescriptions and labs and everything that runs through there. So I think this would be a good spot to analyze the cost.
This is generic, brand, and specialty, yeah? Not just generic.
So all drugs
All
purchased
together.
All drugs purchased.
outside the center.
Right.
The center prescription drugs, if my memory serves me correctly, are running on an average of about 15 grand a month.
And last year we looked at breaking down our co-pays and costs a little different way, but we ended up staying where we were.
Yep.
So maybe if you guys get a chance just to review that presentation on options that we did look at to control costs, so you don't have to start from scratch that way when that comes up. Any other questions?
Yeah, and just another interesting side note to that, Madam Chair, is the fact that from a out-of-pocket expense for the member, it's running at about 17–18% to the member. Their co-pays are running about 17–18% on average.
And I do think our generic rate, though, was high.
Yeah, we still have very high utilization of our generic prescription drugs.
I think above national average, I think, on that, but I think the specialty probably.
And I would bet when we get that report with regard to what kind of drugs, my guess is that one of the number ones will be stress reduction drugs. Because as I recall, looking at those reports before, that was our number one, and number two was stress reduction drugs. I also sent a report along with this on the RX rebates. As you know, some PBMs tout a good savings and a good cost and etc. But this particular organization, which is really a group of business owners band together, started their own consortium of purchasing drugs, and then hired some drug folks that worked in other drug organizations, other PBMs. So they started their own organization, and that's what we're in. And as a result of that, all the rebates come back. They don't keep a dime of the rebates. All the rebates come back to the trust. And then they also have not only just the rebates, but they also have a true-up process that after 6 months to a year, they again true it up, and if there's additional rebates due the trust, they pay those. And you can see here from this last report, if you add all that far right column up through current 2017, the trust has received $295,188 in rebates. And I challenge anybody to find a prescription drug PBM that has any better results than that.
And they seem to be growing this year, our rebate numbers.
Yep.
All right. Anything further on any of our medical reports? Okay. Then we will move to our items for discussion and possible action in this category. So up first are our financial statements. So I'll hand it over to Mr. Murray and Mr. Bonney to kind of report here.
Madam Chair, before I turn it over to Mr. Bonney, just in reviewing the Morgan Stanley statement dated for October 1st through the 31st, the cash account in which the majority of transactions occur had a balance of $1,418,916. The other account that we have as more of our investment account, which also does contain cash. We had $643,796 in cash, $977,314 invested in certificates of deposits, for a total of $1.6 million, $1,621,110. We are no longer depositing money into the Morgan Stanley, as that is, as we all know, is closing. So we have recently made a deposit into a new Wells Fargo account. That deposit was $814,474.40. That was made just within the last few days.
Now that November has started, maybe this is a question for Gilspar. Are bills being paid out of the Wells Fargo account now or not yet?
Not yet, no.
Okay.
Probably December 1st, once we get everything finalized and established. But everything's going smoothly, though. We're right on track.
So we think December 1st, is that what you said?
I'm pretty sure it'll be ready to go by December 1st.
Okay.
Yeah.
I know in a previous conversation with Mr. Collins, are we still considering a stop pay date, just to allow us some room to make sure that we leave adequate funds in Morgan Stanley to cover those checks that are currently out there and committed, and then starting December 1st?
It's a very good idea. I don't know that those conversations have happened yet with Morgan Stanley, but a run-out period should be established because there's going to be checks out there, because we're doing check runs up until the end of this month. So there'll be checks out there. So there should be some kind of run-out period established or coordinated with Morgan Stanley. And then starting December 1st, we'll start using Wells Fargo.
And they are expecting that run-out period, they're okay with that?
I don't know.
They are.
They are?
They are.
Oh, okay.
I spoke to Jill.
Okay,
And they're okay with that. I just didn't know if we were going to stop any check runs maybe a week or two prior, just so we can let those checks that are currently out there
First available date.
Yeah, we can certainly do that. We can certainly make a stop date.
And then
Aaron
maybe
or
just
Dave,
allow
you wanna
a
let me-
2-week period to just stop pay on most things and then start again.
We can just suspend everything until we're ready to flip the switch on Wells Fargo and then let everything run after that.
Okay. Or I will let you
Yes.
coordinate with Mr. Collins, but I would like to see that, just to make sure that we have adequate funds in Morgan Stanley, since we are not making deposits there. I don't see that there'll be an issue, but just to make sure.
I think your check runs happen on Mondays?
No, Wednesday.
On Wednesdays?
Yep.
Okay, so let me look at the calendar real quick. All right, so the final check run would be on the 29th, so I'm wondering if on the 22nd, let that be the last check run.
I believe that would be fine. It's a 1 week or so delay. I don't think that would make it a big, we're not going to inconvenience, I don't want to inconvenience anyone who has money coming to them, but I think a week's time should be fine.
Especially with the holidays.
Yeah.
So do a hard stop, final one on 11/22? Okay.
I would recommend that.
And then we'll have to we'll be doing the run out, as and Mike and we talked about this last week, but making sure that with the outstanding volumes of the checks that are out there, the ones that haven't cleared yet, that we have sufficient deposits to let that run out in some time, so we don't have to void and reissue a bunch of checks. So Mike's been in touch with the Morgan guys and our folks, and to make sure they'll let us do that run out so we can do it.
Okay. All right, anything further on the Morgan Stanley or Wells Fargo accounts? Questions there?
Did we ever decide if deposits were going to go into the interest-bearing account as opposed to the operating account?
We have not. That's a
We had talked about that because
question now. We've not gotten into that yet.
No, because the investment account hasn't been opened yet. It's in the process of being established still.
Okay.
I think that was one of our outstanding questions was, once that's established, where are we going to direct those deposits?
Sure, okay, thanks.
So if you guys will just make note for us to revisit that once our investment policy is set up. Any other questions? All right, Mr. Bonnie, can I turn it over to you?
Madam Chair, I'm going to be very brief. Everyone should have received the financial statements as of October 31. I have nothing to say about them, so if you have any questions, I need to answer them.
Can't get more brief than that.
Just to make one point that Mr. Murray raised, there were no deposits in October. So on the statement of activities, you don't see any revenue there. That's because there were no deposits to the Morgan Stanley account. It was pretty much a cash basis. Yes.
Mike, I just had two real minor questions on the telephone expense and utility expense, and I think we had I think I know the answer, but for October it was like $450. Telephone, I think, would be fairly a constant, and so, but for the 4 months it's like $3,600, which is about twice as much as it would be. And I know, I think one of the answers was, in addition to telephone, there's the internet service and stuff like that, but I would think that on a monthly basis it would be, I mean, usually you pay those services on a monthly basis pretty consistently, right?
You would be correct. These financial statements are prepared on what was actually paid, not necessarily what was or has been incurred.
Okay.
I think, and now that I am starting to receive the payables as you are, if you look at those Frontier invoices, you're going to see at least the ones I looked at had a beginning balance of like $1,300 and then a payment of $400. The only one that I received so far was the approvals for the internet charges. So I can't speak to the telephone, and I assume it's still Frontier. Right? Correct. You know, that's the only explanation I have, Hal, is that we are preparing these pretty much on a modified cash basis, looking at what came in and what went out. So if it didn't go out, it isn't going to be on here.
Okay, and then utilities, I'm just figuring the 4 months, it's July, August, September, October, they'd be heavier in the summer months anyway, so they're not going to be a constant more, like the telephone.
Right.
The telephone would be more of a constant, utilities would change with the weather.
That is correct.
Okay.
Now, the internet service is pegged at $450 a month.
Okay.
And then the telephone runs a different number. They're both with Frontier. But you have your telephone running on a monthly basis, but you have a set amount for the high-speed internet.
Sure.
And that runs $450 a month. And I'll also tell you, Frontier can't get their act together.
Yeah, I know.
They bill us, and we've already paid. Gilsbar's paid those every time they come in, and then Gilsbar has to call them and say, yeah, we paid that, here's the check number. Oh, yeah, well, okay, we'll give credit for that, but it's constant. It's been that way since day one.
Just a side note on Frontier, I have a friend in business, and they've had extended conversations with Frontier, and Frontier has pretty much told them, we really don't care about Arizona. We're more of a back east company, and we have no intention of spending a lot of money out in Arizona for different things. And personally, we were having trouble with, I have Frontier at home, we were having trouble with it. They sent a technician out about 5 days after we called, but I did get a $10 credit on my bill. So that was, they had nothing, I mean, just everything's real slow, but I had a $10 credit, so I guess that's pretty good. But that's, I think that's going to be a concern within the city here, because from what I understand, Suddenlink and Frontier are about our choices, unless, I know there's some wireless stuff out there, but basically, and I know John will attest to Suddenstink and Frontier. So that's the choices we have right now. So going forward, it'll be interesting to see what happens with our high-speed stuff. John, I don't know, can you speak to that? What's going on with that?
We have, if we're paying $450 a month, we have Metro East circuit through Frontier more than likely. We're not using DSL. And there are service level agreements against those circuits that they have to deliver so much latency so much bandwidth, and then if you do have an issue, there's a certain window time frame that's built into those as far as response goes. That said, that's still a copper circuit, and that area of town is a relatively old build point for Frontier. We've seen Metro interconnects in there blow apart, and 24 to 48 hours of downtime and the inability to fulfill the service level agreement. While Suddenlink also has its issues, the plus side for Suddenlink is their fiber optic. When we had all the pain when they came into town, they were actually building a fiber optic network as part of the takeover NPG. We see their fiber optic circuits, and we don't have issues with fiber optic. Cable modems is a different story, but at the fiber optic Metro E levels, stable stuff.
Okay, thanks, John.
When we initially put this in, the technician that worked here in the school district was also the technician at the center, and he highly recommended Frontier as opposed to Suddenlink at that time. And obviously it's been 5 years ago. So if Suddenlink is, Aaron can jump on that and see if that makes a sense to make a change.
And I think that would probably be included right in our fixed cost review when we do the center review. So that may be something that we can address and take a look at.
That's all the questions I had on the financials.
Any other questions?
I just had one, Mr. Buddy. So I did see that you broke down the income categories in more detail for us so that we could see those. Just wanted to make sure I was clear. The additional district contribution, those are just those one time, so then we won't continually see much in there because we've made those one-time payments?
That is correct. Yes.
Okay, so then as it goes down the district contributions, that's what's really being put in for employees?
That is correct.
Okay.
We tried to get it a little clearer for you.
Yeah, I like that. That's good.
Okay. And I do want to point out on that same statement that year-to-date accounting, professional fees accounting of over $7,000, that's not me. I just wanted to point that out. I wish it were, but it isn't. Any other questions?
No, that was all.
Thank you.
Thanks,
Thank
Mike.
you.
A copy of the financial statements are in the business office.
Thank you.
All right, so then in 3.2, we have our investment policy. And do you have any update? Because I did receive back from legal, I can update on that, but I thought if you had anything to add with the investment policy?
Good afternoon. So hopefully you've all had a chance to look at it, and I did receive one response and I made a few changes.
Okay.
Al was nice enough to forward those. I would say, just generally, this is a very conservative policy. It's a very safe policy, so I don't think you should have any concerns from that standpoint. Going down the road, if you want to expand the options over time, we can relook at that. So this is your policy. You know, obviously we were trying to help you out by providing that to you, but it's your policy, so feel free to change it as you see appropriate. And but yeah, as a board, I would feel just to you is I wouldn't be concerned as from a risk standpoint. It's a very conservative policy. It follows the public money guidelines. So I think
I had one
it's about as
question
conservative as you can go. So.
on the diversification. It did allow a maximum of 20% into the open-end mutual funds and ETFs. That's where I was a little confused at the last meeting. So are we allowed to have up to 20%, or what would qualify within that category for us to be able to invest in?
So you could invest, or we could invest up to a maximum of 20% of the portfolio that we have, and that would include whatever's in that investment account, into, for example, let's say there was a mutual fund that was investing in, it would have to be in securities that were listed in the previous parts of the policy, or if you go to ARS 35-323, it says these are what you can invest in. So it would have to, it could be equities, it would have to be, government, corporate, municipal bonds that are all highly rated.
But the state,
within a certain security, within a certain, so the only way we could do that is if within a prospectus of that mutual fund, it specifically said we can only invest in, let's say, U.S. Treasuries within 5 years. And then maybe based on liquidity and cost, we felt it would be advantageous to put some of the money in that.
right.
I'm not saying we would do it, but it just gives us the option to do that.
But the state would have a list of what is approved in
The
that.
state of Arizona would not have a list. It would be up to me to go through the actual prospectus of the fund and verify that it's honestly, it's a very short menu of funds that would actually meet those requirements. And we have used it sporadically in the past. Like I said, there's times when some of the corporate bonds and municipal bonds, they're just, sometimes it's more expensive for us to trade them, and when we can get more liquidity, and it's actually, even though we try to avoid mutual funds because it's an extra layer of fees, but there's some cases where it does make sense.
And then what do you see as a timeline for us with our transition with the accounts to be able to kind of start the investment accounts going?
Our goal, I just talked to Wells Fargo yesterday, they were hoping to have the investment account ready by the end of the month.
Oh, okay.
If, it could go beyond that, maybe by a week or two, but as soon as that's open, my understanding is that Morgan Stanley is looking to have us move those funds immediately. And then once those funds hit the account, I mean, we would have them invested within, days. The only question I think, like you was mentioned earlier, is we just need to have the discussion of how much needs to be available, liquid each month or each quarter to transfer to the checking into the operating account.
All right, and then I did have the policy reviewed by Ms. Sellers, our attorney, and just for members of the trust, she feels that everything looks pretty good in here. The investment policy, though, did reference investment manager and a trust administrator, but she said that she addressed that with you, and maybe that's been defined in that agreement, or maybe not yet.
Not yet, yeah, I have not. So, yeah, that language is depending on, clients, they refer to different roles.
Do we need
So
to
you
specify that specific to us?
I'm sorry?
Do we need to specify who the investment manager and the trust administrator would be in our document, or?
I don't believe you need to specify us as the investment manager in that policy, because that's sort of a generic policy you could hand to if you wanted to have two investment managers. But as far as the administrator, or if you want to remove that language, and
that was really her only comment, is that we just needed to define what that would be. I don't think we need to specify.
Sometimes we report to a like ECA or a different entity where we provide some material to them, some reports to them that they forward on to the board. Sometimes we go directly to the board. So I guess that's why the reference administrator. But again, you can tweak that however you think.
You can do that outside of the agreement, Madam Chair, so you can say Mike Murray.
Right.
Or whoever, or by title, you can do it so they're coming to your staff.
All right, and then everything else reviewed well within there. So were there any other comments on the policy itself?
Nope.
Do I have a motion to approve our investment policy?
So moved.
Second.
Mary?
Hal Christensen,
Yes?
Marcia Cox,
Yes.
Sam Scarmato, Carrie Thompson.
Yes. So then once we feel that the accounts are set up enough that we can start deciding on how that breaks down, are we gonna do that at a regular meeting or call a special meeting later to decide investments, or is that now just taken over by Claremont?
Typically, the way it would work is if you could put me in touch with whoever's going to be, so you're going to have the option, once it's set up, to electronically move money back and forth intraday. So whoever that person is typically would interface with me and say, you know, we're anticipating, you know, next month, this next quarter, you know, just come up with a schedule so we can plan out the maturities and how far out we can invest the funds, and you know, so just make sure we have the money available. Everything is going to be super liquid, so you know we can respond if we need to with all the funds, you know, at any time. But it just helps if we can have an idea what the cash flows are going to be. But whoever that person, once that person is identified, that's somebody, if I could, you know, interact with routinely, that would be
My guess, Madam Chair, is we would do that with Mike's office, and then, there'd be a conversation probably between us, Gil's Bar, and Pat's office in terms of what the cash flows have been by month.
And then we will see what's like your normal reporting, like quarterly reporting, to look at the investment portfolio, or annual, or...
A lot of that's up to you. So you'll get a monthly report that's going to go straight, I assume, to Mike and to the board from Wells Fargo. If you want supplementary stuff, typically we do quarterly and an annual, but if some boards have a financial that's every 2 months, or you know, 3, you know, it's just we can adapt it to what you're looking for.
Okay, I think we can coordinate that through ECA. Okay.
Madam Chair, this might be more related to 3.5, but did you want to touch on your concern regarding transfers and dual authorization for transfers? I know we had that conversation.
I think I was going to handle that in 3.5, but...
I mean, I just maybe just specifying the account here with the investment account versus the cash account. When you're talking about transfers, is it strictly between those two accounts only, right? Not any outside account transferring authority? We just had a question and a concern.
Absolutely,
making sure that it's very restricted as to you can transfer from A to B, no outside account,
usually
personal bank account.
it would be somebody in your office that can just go between the two like registered accounts and nothing else.
So there's no access to any.
And to take money out of the, you know, to a third party account beyond those two accounts would take 2 board members. I don't have the authority to do that. So.
And then with that comes the issue of who has the authority to set up those transfers to begin with, either on an individual basis, like a one-off basis, or on a repetitive basis. So that'll need some kind of dual process to control it as well.
So you'll get signature cards from Wells shortly, where you guys will all have to, whoever's going to be on the account, board members, or this person will have to sign, and then there'll be little boxes you'll check which say what authority they have.
And then an investment
I'll be on that
account
list.
has dual signatures, so it's
It'll
people signing.
denote that, yeah.
Okay.
Yeah, the transfer between the accounts will typically just be one person, so they'll get a check register. It's anything that goes outside.
Yeah.
Definitely want 2. That way 2 of you go to jail, not just 1.
Yeah, thank you.
Just so you know, most banks don't check 2 signatures, just so you know. A lot of companies have dual signatures required, but when those checks go through for clearing, they just clear it.
Yep.
Just so you know.
Thanks, Al. You made me feel really great.
I learned that lesson in banking years ago, and I was just, because the boards I've sat on, we've instituted 2 signatures required. And when I was talking to the operations people at the bank, and they said, that's fine, but we don't check those. It's virtually impossible to. The readers that read, they read the micro numbers is what they read. They don't read signatures.
And for the record, we're not talking about ink signatures, we're talking about electronic signatures. So this is in the transfer accounts. So it'd be two separate folks who would have some form of access.
Right. Yeah, there'll be, we'll have controls in place for us. For example, I mean, if we want 2 signatures required, and we're working with Mr. Murray, certainly if there was 2 of us or whoever, that would be kind of internally monitored, because banks don't, just for information. So everybody's confident.
Did you have to say that on
He did.
I did, just, yeah.
Okay, anything else with our investment policy? All right, well, thank you for presenting, answering questions, and I'm sure we'll be in touch. 3.3 is our actuarial service contract, and ECA will present it.
Madam Chair, members, this was the second part from the RFP, but we brought in with that a separate actuarial firm, completely separate, which is Mike Shunning of Chiron Group. This is his contract. It conforms to what was in the RFP in terms of all the pricing, the stipulations. The responsibilities will include rate making, COBRA rates, pricing individual adjustments, that when you're going through, you'll be pricing some options, looking at, like, if you want co-pays or you want to change deductibles or in and out of network or vary on the Cerner, and it literally becomes kind of checklist by item. Every one of those items will have a dollar associated with it. In addition, doing the annual incurred but not reported IBNR liabilities, which will post to your cappers, and then separately to do the GASB liability for the retiree benefits. And there's pricing on each of that, and there's also an annual cap. In addition, he is working now on ECA's dime for any work that's related to the Cerner Clinic. So basically, all of this is as was proposed, but you'll notice the differences on the contracting. So the contract runs fairly extensively, includes no kickback provisions and no collusion provisions. There's a specific subsection of the statute that requires that there actually be an appropriation of funds or the contract's void. So fairly extensive set of terms. You'll see this pretty standard on all the contracts that we do on behalf of the trust. When we do our end-to-end report, it will also include, as a standard, which is on here as well, that any contract entered into on the trust have been approved as to form by legal counsel for the trust too. So this one conforms, it's almost identical to how ours operates, has all those same types of provisions, so you'll be seeing this format on a standard basis going forward. We'll also probably, and again, just previewing a little bit, because Jamie and I have already been started to spec out the end review, but you'll see this form as applied to as many of the vendors as we can get to do. You don't do it for PBMs, that type of thing. You'll see it probably on the TPA side, and when we're making recommendations on recontracting our RFPs, it'll typically include using this type of a contract and going into the RFP document. So you'll get used to it. It's pretty wordy, but it pretty much covers all the bases.
On the GASB 45 report, did I see that right, that we do that every 2 years?
Correct.
Instead of annually?
And it's
So then that
transitioning, I
cost
think
is-
it's effective in July of this year. It's transitioning, they have changed it, and I believe it's GASB 74, 75 now. They've tightened it down somewhat.
Okay.
So it's whatever the GASB requirements are for those post OPEB, other post-employment benefits liability. And they are substantial enough, obviously. I can't remember what the number was on the GASB 45, but you do have to post them to your CAFRs every year, so it is a big one. It's kind of like the dollar value of sick leave. You have to accrue all those liabilities on your financials for the district itself.
So this scope of service with all of the actuarial work, where were we getting that before?
There's a separate firm doing the OPEB liability. I don't know specifically on where the rate making or any of that was occurring in the past.
Okay. And who would know that?
Dave would.
We worked with Gilsbar's actuaries. We didn't pay anything for it.
So Gilsbar was, or your actuaries were actually doing all of this?
Not all of that, no. They would just do the claims and plan experience and actuarial review of the utilization. And not everything that Aaron talked about.
Okay. So we weren't getting all of this before?
No.
And then who was our gas fee 45? Because we contracted that one out, didn't we?
Yes, we did. First name Frank, I can't think of his last name at the moment, but it was from back east.
Okay. Now, I guess this question I would have, would Gilsbar still continue to kind of run their analysis so we can kind of see how that matches up?
Absolutely. Mm-hmm.
But what I'm hearing you say is that Gilsbar was not part of making the recommendations on the actuarially, anyway, for premium recommendations.
There, who gave us our recommendations on where we should set our rates each year?
No, we would do suggested percentage increases on the current rates. Now, whether those were accepted or carried out, I don't know, but we would do suggested or proposed percentage increases on the current rates.
Does this need action?
It does, it needs a motion to approve. And then authorize, that kind of goes implicitly, I'm not familiar with how the trust works, Madam Chair, but to have the chair execute on behalf of the trust.
And so I noticed that there's also a line for Ms. Sellers to sign, so does this need to be reviewed by her before we do that, or we're just going to?
Yep, always, the attorney always
Right.
approves as to form.
Okay. I move that we approve this actuarial consulting services agreement.
Second.
Mary?
Okay, Marcia Cox,
Yes.
Hal Christensen,
Yes.
Sam Scarmato, Carrie Thompson.
Yes. Okay, and then 3.4, we are going to address our lease on the building at the center.
Okay, so Madam Chair and trustees, Hal was kind enough to meet with myself and the current agent representing the owner of the building. We discussed renewing the lease on basically to conform with the expiration of the Cerner contract, which I believe is March 31st.
Yeah, the end of March 2020.
2020. I haven't heard back from him yet. I don't know, Hal, if you have.
I've got an update on that. So,
okay. So Hal can fill in.
Well, at last week's work session, I had mentioned I was going to reach out to another commercial realtor. Two things. One, he's out of the country right now, and second, in talking to the agent who represents the landlord, works in the same brokerage as I, Coldwell Banker, and he had mentioned to me that there's no commission to be had on this renewal. So from a conflict of interest standpoint, that kind of lets me in more because there's no money to be had on the renewal. Okay. And so, like Aaron said, we met Tuesday with the other realtor and crafted up. Currently, we pay $32.75 a month base rent, which equates to $1.10 a square foot, and it's a triple net lease. And for those not familiar with what a triple net means, the tenant pays base rent. In this case, they occupy 100% of the building, so it's not a pro rata share. They pay real estate, property taxes, they pay building insurance, and they pay repairs and maintenance. So the tenant is essentially responsible for everything.
Except the air conditioning.
in the event of a replacement. Yeah. And there's some triple net leases where the owner is still responsible for the roof. So, but in this case, it's a fairly standard triple net lease. Price-wise, it falls right in line with, there's a lot of medical buildings operate under a triple net lease, and the $1.10 is a good market rate. The comment was made that there's another physician in town who is interested in that building, and the representation was made that the landlord will renew this for 26 months, which will tie it into Cerner on March 31. The lease expires the 31st of January of 18. So this would take it February 1st of 18 to March 31st, 2020. Okay, and that would tie into the Cerner. But the comment was made that in 2020, changes may come, rate-wise, and the economy is improving, and in my experience in commercial real estate, other rates are starting to go up. What the landlord did ask for is to give them a heads up 6 months ahead of time before the lease expired. Traditionally, it's 60 to 90 days, but in a case like this, it could be pretty involved. So they were just asking if they could have a 6 months heads up on yes, we want to continue, or no, we're going to be exploring another location. So I have an addendum here that has been prepared and signed by the landlord, and I can give it to Carrie. It can be, and Aaron, and it can be reviewed, and we have till January 31st. Yeah, we can. We were supposed to let them know within a 90-day window our intentions, which would have been October 31st, but the landlord is okay with negotiating right now, but they'd like to get this done certainly sooner than later. I don't know if we can take action on it tonight or not.
Yes.
Okay.
But we can approve that now. I still need to get the lease reviewed and then.
Right.
So is she okay with the continued at 110 square foot?
Yes. They will keep it at $32.75 base rent, triple net.
All the way through.
All the way through March 31st, 2020.
Just to state the obvious, what that still leaves for both for that and the Cerner contract, still leaves an off-plan year. So, because your plan year being a July 1. So at some point, depending on how things go with the clinic and the lease, at that point, that'll be one of our thought process will be to align everything.
Yes.
For July's to get everything onto a common basis. But that 6-month provision is fine. I mean, from our side, we don't see anything unusual about that. I think, given the nature of it, that would be a good idea anyway for everybody. It kind of forces back onto you guys as trustees to come to a decision as to how the clinic's going to figure into the benefit plan going forward. And I think that, from my side, I think that works realistically with the timeline that we're envisioning.
Any other questions for Hal?
So how does that come into play if we're reviewing that Cerner contract right now and looking at all the parts and pieces of that and determining if it's...
It's an excellent question, Marcia, because we talked about that too, and it's basically, we're taking a position presumptively that the contract is enforced based on the evergreen provision of it. We recognize, I'm not an attorney, so with the qualifier, I'm not giving a legal opinion, with the evergreen provision on there, regardless of the signature and the title, from our side, we're assuming presumptively that that contract is good until 2020. If we were to come up to a decision where the attorney looked at it and said it's not good, then we got a problem. But I think, but realistically, I don't have a functioning alternative recognizing the lease is up on the building, right? And we've got a question on the contract versus a certainty. So the lease on the building is a certainty. The contract issue, while valid, is I don't know that we're in a position to make a decision that rapidly for the trustee to away.
And the landlord more than likely would not entertain a year-to-year because she wants to set that rate.
Right. She was looking at a 3-year renewal. That's what they were trying to craft, and in explaining what's going on with the Cerner contract, they were okay with 26 months to line up the dates.
So our recommendation, just for the record, to go on record, I would say our recommendation would be authorize the chair to execute the term through the March 31st, 2020 at the current terms with a 6-month notification provision.
Do I have a motion on that?
Can I make the motion? Even though okay, I'd make that motion, and I'll give the addendum to a copy to Aaron, and then the original to Carrie for review.
Second.
Your second. Okay. Sam Scarmato, but you didn't hear it, so. It's
Pardon
Sam
me?
Scarmato. Are you?
Aye.
Okay, all right. Hal Christensen,
Yes.
Marcia Cox,
Yes.
Carrie Thompson.
Yes. All right, and then we can move to 3.5, which is the approval of additional signers to the new Wells Fargo account. Do you want to present any information, Mr. Murray, this way, or do you want me to discuss this?
Yeah, let's go ahead and just open it for discussion. I think that, well, let's, if I can, Madam Chair, just in the short term, as we're trying to quickly make this transition, I'm an authorized signer, and Ms. Thompson is also an authorized signer at this point. So that's why this is now an agenda item to discuss that even further, whether or not we should add additional signers to the account. So that's why it's presented as an agenda item tonight.
So we need to decide as a board. When I had a discussion with Mr. Murray on this, because I needed to sign as a signer to set up the account, I had requested that we look at additional signers, and with Mr. Murray's recommendation, which I do agree, is we wanted to add the superintendent, Mrs. Sire, as a signer also, so someone at the district office would be available to be that signer. And on this account, maybe Mr. Murray can clarify this a little bit for the board too. As far as this goes on the Wells Fargo account, is this the checking account and just transferring between checking and investment?
Correct. At this time, we're talking about just the actual cash account that's currently set up. And we do want to add that Gilsbar is a signer on that account so that they can process the check. So I did want to add that to it. So they do have signing authority as they process payments. But at this point, it's I would just recommend just carrying that list of signers with the exclusion of Gilsbar to actually be those who would have authorization, I guess, if you will, to initiate transfers, unless we want to.
I just felt like
The way it was presented here just this evening, I don't even know if that's necessary, because if we are going to just authorize transfers to and from the investment account to cash, that we need to have that many on that list. Maybe perhaps just the individual who's the business director and the chairperson of the EBT being those who can initiate that transfer process. It sounds like that we can't transfer anything out of between those two accounts, so it's not like there's a risk of transferring that out of the EBT accounts and into some type of private account. That was our main concern, is that we wanted to make sure that those restrictions were clearly in place, because it's just best practice to make sure that that's there. So if that is no longer an issue, then perhaps just having someone from the business office and someone representing the EBT board be two signers within that has that transfer authority. Just a suggestion.
Yeah, and my only concern there when we discussed that is just making sure the cash account always had sufficient funds to pay for the checks. So sometimes those needed transfers. And I just saw another person at the district office that could sign in the event that Mike Murray's not there for that to occur, because you just want your bills being paid. But
So then I would recommend, if it's okay with Mrs. Asire, to go ahead and just leave two representatives from the district on that and one from the trust.
Madam Chair, in the past, there's been checks available in the case of an emergency or a refund of premium to a member, or in one case, they were going to shut off the lights at the center, so I know Mary has had a check signed by a former trustee that was a signator on the trust to take a check to our electrical supplier. So there's been some instances where actual checks, live checks, have been issued out of the district. They kept the checks in the safe. But in case of an emergency, there was a check for somebody to be able to make out and sign and deliver somebody in town. So you may want to think about that as well, Mike.
Thank you.
And a point of clarification too, Madam Chair, we believe what's currently happened with Wisconsin RX is they're directly debiting the account as well.
Correct.
okay.
So we'll need to have provision made for that too, so that the scripts can come out as well. I think we can handle that with Mike Murray and his staff.
Okay. Sam?
Is what you're saying, having a couple pre-signed checks, just pre-signed checks. I think what Aaron's going to get towards it, there's a mechanism for debiting, but I don't think it's legal for an agency to pre-sign checks.
It wasn't pre-signed.
Oh, okay. Well, that's what I was asking for clarification.
It wasn't pre-signed, it's just that it was needed, and we needed to get a check. Then one of the trustees, either Cinda Ross or Colleen Pankow, would come in and sign the check so that they could go get it paid.
Okay.
But it wasn't pre-signed.
Because everything knows ACH anymore, you can do that stuff with online transfers in a matter of seconds. So that's practically all we use in our business anymore.
So you have
I don't think
two
this is
people
on
from the
the
district. Do you want two people from the board in the event you're not around?
I think that would be prudent.
If it requires two signatures, I think that would be a wise,
I think
having
it is
back
too.
up on you.
Okay.
Does anybody want to be a second signer?
Aren't you already a signatory, Carrie?
I am, but
That's what
I'm
he
not
said.
a second.
No, we're saying a second person on the board in the event Carrie's not around, or she might have a big
But
volleyball
this wouldn't
tournament.
require two signatures, correct, for these? It would just be a, so Mr. Murray could still sign.
Just to clarify, so between the two accounts, you can do that on the computer. We're only talking about checks outside.
We're talking about issuing a check, and the example that Dave gave, where we want two signers on the check.
If they don't want you, who cares?
There was a good point brought up too. Perhaps just in consideration that you perhaps look to the governing board representative who's on the board as being a signer. That way you have EBT representation and a governing board member as well, and that's just something to consider. That way there's always somebody, no matter what happens to the dynamics of the board, when people are coming and going, there's, according to the bylaws, that there's going to be a chairperson and there's going to be governing board representation, so perhaps it's something just to consider.
That makes sense. Pat, more responsibility, no voting authority.
Do we go to jail together is all I want to know?
Yeah, you and Carrie, not Sam and Marcia.
But if we look at
We'll come
that,
visit you maybe.
I do think it makes sense for our
okay.
liaison from the board to
Sure.
be that person,
Okay.
because
Not a
then
problem.
the EBT board would know what was being.
Yep. I agree.
Just measure my wrist.
And Madam Chair, this is strictly for checks,
Right.
not for transfers.
Right.
Correct, check,
Right.
check sign.
Okay. I agree.
Congratulations.
Well, thank you very much.
Do we need a motion
We
for
would
that?
need a
or-
motion to add,
Yes,
because
we need a
currently, Mr. Murray and I are signers. So we need a motion to add the additional signers if we want Mrs. Sire and Mr. Rooney.
Yeah, I'd make a motion to add Mrs. Asire as a district representative and Pat Rooney as a board representative as signers.
Second.
Oh, we were friends.
Okay, Sam Scarmato,
Yes.
Hal Christensen,
Yes.
Marcia Cox,
Yes.
Carrie Thompson.
Yes. And while we're discussing, or while we were looking at additional signers, and while I have Ms. Asire here, did you want to, is this to address?
Well, it's not related to this.
Oh, okay.
So if you want to wait till the end, I'm fine.
Okay, all right, thank you. All right, and then we can move to 3.6, our clinic cost analysis. So I'll hand that to ECA.
So just an update, Madam Chair. So we're actually in the process trying to getting a meeting scheduled with Cerner. Right now, we're waiting for a reply for whether or not they proposed 9 a.m. on the 21st for a teleconference. We countered back with 8 a.m. just because we had a scheduling conflict, we had a preset meeting. So we're waiting to hear back for that. So that's where we're at. We've got everybody, as of right now, we've got everybody but Cerner agreed. So Gills Bar's agreed, Mike Shunning's agreed. We're available. We're just waiting for them to do 8 a.m. on the 21st to go through it. And that'll be what we talked about at the last meeting. You know, how do we break the fields down? You know, that whole thing. How we get everybody to a common place.
Anything further from our work session that you want to pass to ECA?
I want to make sure that when the review is done, that we go through that cost comparison that was done, the 5-year cost. There's 3 tabs on there. The middle one includes the encounter IDs. They're identified for things like physical exam, 50 minutes, condition management, 25 minutes, advisor visit, 30 minutes, illness visit, those kinds of things, and see if we can map those to clinically acceptable standards for CPT codes. I looked at the PowerMate EMR system that Cerner, it's a Cerner product, obviously, but and I know that they're not using CPT codes at our clinic. I know that that particular EMR system does use them for other clinics, no matter, I mean, just depending on whether or not they're going to use those. But so I'm hoping that there's a way to map those back so that we can get a clear definition on cost, because some of the encounter IDs that I looked at were a little bit confusing because there was a illness follow-up 30 minutes or an illness follow-up 25, and in standard acceptable practices there's not just a 5-minute change, it's a complexity level of service. So I guess I'd want to make sure that we could do that. That'd be, you know, something that I think it would be important.
Yeah, if you're, I mean, frankly, from my side, I know you had mentioned some specific codes. I mean, from my side, you're welcome to sit in on that, and I'm sure if those present an issue, if you're available, Marcia, and you can also give us those clinic codes that you're specifically interested in. Because we're gonna, frankly, what we're gonna try and do is get them to talk about what maps out, and then kind of do this interactive thing with Gills Bar about how that translates across. Because what I don't want to do is get back into a position where after we've done the work, somebody comes back and raises an objection. I mean,
right.
It's easier to just say, hey, these are the parameters, this is as close as we could get it. If for any reason somebody says you can't match it directly, we're going to try and get it screwed down as tight as we can. But if nothing else, we'll agree what the qualifiers are.
Right.
We'll do the evaluation.
And I think the other part is just making sure that, because there has been a continuous confusion on, because we do our wellness program there, and we do, you know, our personal risk assessments and whatnot, and then we have a clinic that I will identify as a sick clinic if you have, you know, an ear infection or whatever. And so really, you know, truly breaking those out, because we do see, and as you saw in the Gills Bar report, you know, we have people that go into the community for their preventive exams. So, you know, I think I'd really like to see, not necessarily the physicals, the preventive physicals, although that would be interesting, but you know, the wellness part of the center and the sick visit, if you will, part of the center. Because I think that makes a difference.
Okay. That's pretty much in line with what we were talking about too.
I think so.
Yeah, because there's a clear component in there that's kind of like the minute clinic concept. You know, I'm in for my throat, that type of thing. You see it reflected in some of the drugs and the visits too. So.
Okay, anything further there? All right, then we have no appeals, or we have no need
Now,
for?
there is a motion, I think, attached to this, isn't it? In the memo, you said there was a motion. Is that, do we need that motion?
This was, the motion on this one was probably the follow-up, I apologize.
It was ratification.
It says motion to authorize ECA to work with Cerner, Gilsbar, and Chiron to develop a cost
I was like, there's no
analysis as
cost.
discussed
Okay.
and to provide the Cerner NDA to the trust legal counsel for review.
Yeah, and then to have the counsel, have the attorney look at that NDA.
Yes.
Yep. So,
Okay, so we do need a motion to be working with that, and then have our attorney review the NDA agreement.
I move. Just what you said.
Do I have a second?
Second.
Okay, Marcia Cox?
Yes.
Hal Christensen?
Yes.
Sam Scarmato?
Yes.
Carrie Thompson?
Yes. All right, and then, was there a need for executive session today, Dave?
No.
No appeals?
No appeals.
Okay, so, sorry, that's the end of our agenda, if you want to.
Yeah, thank you. I apologize I wasn't here in time for the call to public, but I just wanted to let the board know that, as you figured out, Mr. Rooney, as the revised trust was voted on now by both boards, is no longer a voting member of the board. And so our Lake Havasu Board of Trustees has agendized for its next meeting, which is the 21st next week, to look at the 3 remaining applicants from when the applications were called for the position that Mr. Scarmato now sits in. And so at that time, they will be discussing those 3 applicants, or the possibility, I suppose they could, as well, of opening it again and see if there's other interested candidates. So I know at the last time that was well advertised, and several of you attended that, so I wanted to make sure that you knew that that was an item for discussion at that board meeting.
That's the one on the 21st? The next?
If that's Tuesday, yes.
Yes. Yeah.
All right. Then, if we can look at a timeline for our next meetings. Currently, we have slated February 21st as our next regularly scheduled meeting, and April 25th. So I just wanted to make sure if anyone knew of any conflicts at this time that we needed to look at. Is everybody okay for February 21st? As far as I
Problem
know?
is, third Wednesday of every month, I have the Humane Society. So if you don't mind me ducking out, they're very short meetings, so.
Third Wednesday. So that would be the 21st?
21st, yes.
It would be.
Okay, so
20th, 22nd, that's fine, or our meetings start at 4 and they're usually done by 4:45.
I'm open on the 22nd or the 21st.
Me too. Or the 14th or 28th, if you want to keep it on Wednesdays. Doesn't matter.
No, 14th or 28th is good for me.
which day is the 14th?
They're all Wednesdays.
Valentine's Day. Do we want to spend our Valentine's Day on insurance? Quite possible. Don't do that, sorry. Don't do that.
Mr. Murray's like,
Okay.
nah.
I think we've got an objection.
Okay, so
How about,
28.
I think the 28th will be fine. I was trying to get this meeting in before my softball season started, but I can address that with Mr. Kruger. So as of
Well,
right now, I'm open on the 28th.
Or the 20th or 22nd, doesn't have to be on a Wednesday, so.
20th, sometimes Tuesdays, we have availability of the
board
boardroom.
meeting. That's a
Yeah,
school
so
board meeting.
Tuesdays are usually
Yeah.
tougher to schedule.
So, 22nd.
Works for me.
Should be a Wednesday. Isn't that one of
Thursday, the 22nd, I'm already scheduled for faculty meetings. And Thursdays usually are in-service and professional development days. So that's why we typically use Wednesdays.
Yeah, so the 28th.
Because of availability of district staff.
Check with Brady for the 28th.
So I think the 28th.
Yeah.
Let's look at the 28th.
And so you don't think we're gonna need a meeting before February?
How about the 7th? I don't know what that would, because I'm thinking in my mind budget, so earlier. would
Earlier is
probably be
better.
Especially if we're talking rates and increases and hopefully decreases, but.
I'm available on the 7th.
We don't really have any, not everything is running, right? July 1st to June 30th, so there's not year-end reports.
I also like to give the vendors a little time to make sure all claims are processed and out the door, and that's why I pushed it, generally speaking, to the middle of the month, to give them ample time to run the reports that gets all the prior month and over year-to-date stuff together, but the 7th is a little short from that, from their perspective.
But we could report through December 31st and then be fine on the 7th. As far as your budget process goes, Mr. Murray, like what do you see? Do you see the beginning of February working better and then okay till the end of April, or do we need that one to be earlier?
Beginning of February will be fine. We'll actually be in the middle of our budget committee discussions at that point. So any
Okay, that's
information we
usually-
can get,
Okay.
we're going to try to finalize the committee. I think the last committee meeting is around the 22nd, the later end of that month. So the 7th would work great. The 14th would work well too, but we just have to beg for forgiveness.
I would not even try that.
I'd like to stay away from there if we could.
That's also Ash Wednesday.
The 7th?
Yeah.
The 7th would be great.
No, hold on.
So we would have to do.
I'm looking ahead at that Wednesday.
Sam, are you okay on the 7th?
Yeah.
Okay.
Just the third Wednesday of every month is the only important one I'm tied up for.
Okay. So let's set that at February 7th, and then reports, then we'll just, if we don't think we can get January in, we'll just go through December 31st.
And Madam Chair, just a point of clarification, would that be your expectation that that's when we would have renewal options and do the entire renewal process with the board?
No, we usually do that at the next one.
So that would be April or March.
So when do they need, when does Mike's
yeah.
office need their numbers?
We typically go to the board in March for budget adoption.
So then maybe
I think it's
so
going to have to be
that
closer
earlier.
end of the month.
So when, just brainstorming with you, the normal process we use would be to have, like, the vendors come in and do a series of, like literally look under the hood, what's happening. We expect this to be a fairly complex review process. Sam's been through this before with Mojave's EBT, and then walk through like the different pricing options for what you're going to do. That process typically takes a day to go through.
Okay.
Right, because then you guys would give us finals and whatnot. But if you're going to do that, so once a year, it's a fairly major one. I expect this will be a substantial one for you guys in that first year. So when in February would you be available to do that?
Are you thinking it would be better to do it later in the month, in February?
Well, it's really driven by what the budget process would be for the district. Here's the impact it has on our end. Shunning is going to get, we're going to compile all of the claims information off the CFARs and off of all the district's records. So we're going to get in the last 2.5 years. He'll develop the claims funding factors. We will put together all the fixed costs and then combine that into a rate. Okay. We can get, the only difference is whether we give him December 31st data or we give him November 30th. Okay, and then he'll move it forward to July. It just depends, honestly, it all depends on how much negotiation goes on back with the district on funding.
So would you be ready to present that on February 7th?
We can.
Okay,
Absolutely.
because I think if
we would
it's
get
in
it out
the
to you a
middle
week
of the
ahead of
budget
time.
process, that seems to work out pretty good on both sides. But you say it's a day event?
It pretty much is, because the morning is essentially, we would typically start at 8 in the morning, walk through, use the morning process to walk through all of the detail, what, and in this case, again, there's a lot. And then in the afternoon, the actuarial part comes in where you start to swap off on the benefits. I think that's a really critical component, particularly for staff input, as because we don't know how the district does the funding yet.
Okay.
But that will definitely have a district funding element to it.
So if we were going to set a timeline, your recommendation would be February 7th to meet at 8 a.m.?
And plan on being here till 3:30.
Okay. And then moving forward, we look at that as being kind of the annual one that's dedicated to that day, like a whole day event.
It'll be a once a year.
Okay.
Carrie, I had already sent out the meeting reminder previously for February 21st, which I'll change to the 7th, but I had invited the insurance committee representatives from the schools. We're not going to invite them all day, right? So I need to explain to them what you're doing, so.
Correct.
They're going to be confused why we're going from a 3 o'clock meeting that we had at 3 o'clock so they could attend that. And all
We could just explain to them, this is the
Yeah.
new consultant.
I guess I
This is
need
our annual.
permission to do that.
And maybe what we could do too, once we have that meeting, is we could then debrief with our staff as to what happened and what came out of that meeting,
How will
too,
you do
with an
that?
insurance committee.
Oh, you'll have
On
another
another
meeting
day.
with them?
Yeah.
On a different day, so tell them that we'll schedule a meeting with them after that? Okay.
Yeah, I think that, would you guys be able to?
Absolutely.
We'd be happy to do that.
What are you bringing
On
for
the
breakfast
district
and lunch,
side.
Sharon?
Mr. Murray?
Actually, we do
or
make provision
Ms.
for
Do you
that.
think that process would be okay?
Have
Have
a different
food and
meeting on a
coffee,
different day with the insurance committee?
Pretty good lunch.
Yeah, to filter out information on what we decided moving forward for the next annual year, so we could pass that information on to employees. Because we don't want everybody out all day. Yeah. All right, and
Yeah,
then,
will this be a time where we'll have like the good, better, best option as well, so we have kind of a range to consider as we budget? Okay. Perfect.
Our standard includes a minimum recommended and a maximum on the funding factors. The wild card here is still how the expenses all play into it.
okay. And then do I have any future agenda items that we see need to be addressed in February from the board? Not
No.
this time?
Not right now.
Not this time.
And Dave, do you foresee anything that needs to be addressed?
Madam Chair.
And I will also pass that to ECA. And you can communicate as we build an agenda for the next one.
Carrie, may I say something to the board? The trust document now, of course, has been approved and signed by all of you and by the governing board. However, when I went to send it to everybody, I noticed that embedded in there, the page numbers are not right, long story short. The version that came from legal counsel, there's something embedded there and it skipped from page 12 to page 16. So I don't want to send that copy out to everybody. Jennifer Seller's office has it now and is trying to fix the page numbers and retaining all the signatures. So once I get that document finalized and the page numbers are right, I'll send you all a copy. For right now, it is posted on the website with the incorrect page numbers, because nothing's different except the page numbers, but I don't want an incorrect copy floating out there with incorrect page numbers. So I will forward that to all of you and repost it once the page numbering is correct.
All right. Do I have a motion to adjourn?
So moved.
Second.
All in favor?
Aye.
Adjourn at 5:25.